Now, police officers saddled with medical bills and difficult life as a result of injuries suffered in the line of duty will now have access to financial help from a 1.6 million medical emergency fund unveiled today by President Akufo-Addo. The fund is part of three major projects unveiled earlier today to boost healthcare delivery for men in the service. The other two, a new outpatient department has been opened at the police hospital to ease congestion, plus a virtual medical center to help officers access medical services anywhere in the country. President Akufo-Addo spoke at the event.
I commend the police administration and the management of the police hospital for constructing this new OPD, which will help decongest the existing facility, which hitherto was responsible for seeing to patients with emergency cases, as well as to regular OPD patients. This new OPD, which cost a modest sum of 180,000 cedis, will be dedicated to emergency cases only, in line with best practices. It will ensure a clear line of separation between emergency cases and routine OPD visits, thereby improving the quality of service delivery at the hospital. I'm particularly excited about the establishment of the Virtual Medical Center, the second project I'm commissioning today at this hospital. As most of you may know, since I assumed office some 5 years ago, one of the obvious successes chalked by government has been the execution of the impressive agenda to digitize fully all aspects of our national life. Constructed at an equally modest sum of 50,000 cedis, the Virtual Medical Center, which is an end-to-end video hospital management system, will allow patients, no matter where they are located in the country, to undertake virtual consultation with healthcare professionals at this hospital. Police personnel, irrespective of their location, can now access healthcare services from the hospital anywhere in the country at any time. Officers of the service are guaranteed a protected platform for seamless consultations with the doctor. Beginning with virtual OPD attendance, through diagnoses, laboratory referrals, prescription of drugs, and subsequent reviews, all of these medical processes can be done without one having to travel from his or her station. Indeed, if the medical situation of a patient demands a higher level of attention, the medical doctor will immediately make the necessary arrangements for the patient to be evacuated to the nearest medical facility for treatment. This virtual medical center, the first of its kind in the public sector, is indeed worthy of it. I'm delighted to launch the 6.1 million cedi Police Emergency Medical Intervention Fund, aimed at providing immediate financial assistance for the medical treatment of police officers who get injured in the line of duty. I've been assured that beneficiaries do not have to go through the usual bureaucratic and the associated delays which have in the past resulted in some cases in personnel losing their lives whilst awaiting treatment and the deterioration of medical conditions of some others. As we present the first three beneficiaries of the fund, Chief Inspector Victor Anako, Inspector Theresa Ohene, and Corporal Isaac Suman Opoku, with amounts covering the cost of medical treatment in Ghana and abroad, I'm hopeful that all police officers who require medical treatment will receive the best of care without recourse to the cost of treatment.
The Inspector General of Police, Dr. George Akuffo-Dampare, indicates how crucial the fund is, especially to those currently reeling from financial difficulties.
To your commitment towards the provision of logistics for the service and also ensuring the welfare and the well-being of the personnel of the service. Indeed, history will be very kind to you when tomorrow comes. More importantly, Mr. President, of the 3 projects that you are here to commission for us, the first one is to do with the new outpatient department, which in the past was part of the emergency department, making it difficult for the personnel to give the best of their services. With the decoupling of the normal OPD from the emergency department, we know that the service delivery at this place will improve and become better than before. The second item for you to look at, Mr. President, during the commissioning is the police virtual medical center, which has been set up for the purpose of ensuring that police people across the country can access health care from the comfort of their homes, the comfort of their offices, the comfort of their duty point, and the comfort of their villages and towns and cities that they work without necessarily showing up at the police hospital. We know that this project, if it is carried on to the later, it will help us a lot and make the access to medical care for our personnel very easy and accommodating. The third one, Mr. President, is to do with the launch of Police Emergency Medical Intervention Fund for providing financing for personnel who sustain injuries or develop one medical condition or the other in the course of performing their duties. And Mr. President, for us to see the significance of this very project, I would like to present to you the first beneficiaries of this fund. And I would like to start with Chief Inspector Victor Mark Anako, who for almost 15 years has been waiting for this opportunity in order to have an artificial leg. He was in an operation in Sawam. They were called to respond to a crime scene, a robbery crime scene, a bank robbery crime scene at Sawam, and he was shot by armed robbers in 2007. And Mr. President, the resources to take him out during those years weren't forthcoming. And this gentleman resigned to his fate and never showed up, and he was fully or virtually forgotten until today that he's being presented. You will be presenting to him the full cost of his medication in Germany. Mr. President, the second person, in order for us to just look at how important this fund is Policewoman Inspector Elizabeth Teresa Ohene, who through job-related sickness became bedridden for so many years. Indeed, the issue started in 2014, and she once again has to wait for all these years before being able to also have the facility, the resources to undertake the operations that she needs. Indeed, she's here today because she has gone through the first session of the operation, and the second one is at Focus Medical Center, which is slated for later somewhere next month. Mr. President, the third person, Corporal Isaac Asuman Opoku, was somebody who was providing the normal police duties of ensuring police visibility and fighting crime somewhere in Kaneshi last year. And he was sandwiched between 2 vehicles. And we can all say that it's just a miracle that he is still alive with 1 leg amputated. And he is also going to benefit from this fund. So, Mr. President, this is what you have been doing for us as a service, and we will forever be grateful. But in a spirit of reciprocity, we want to assure you that we will continue, and I mean we will continue with all our might to act professionally, to act humanely, and to act tirelessly in order to ensure that we protect life and property and we maintain law and order.